Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome everyone. I'm Dina Rajhi, a first-year medical student at Imam Muhammad bin Saud Islamic University. And today we'll cover this topic, which is diabetes insipidus. And by the end of this seminar, you all should have a clear understanding of diabetes insipidus. So I'm going to explain the definition of diabetes insipidus, the types and diagnosis, the complications and prognosis, the treatment and preventive measures, and lastly, take-home messages. So what is the definition of diabetes insipidus? The DI here, D stands for diabetes and I stands for insipidus. So diabetes insipidus is an endocrine condition involving the posterior pituitary peptide hormone, the antidiuretic hormone, ADH, which is synthesized in the supraoptic nucleus in the hypothalamus and stored in the axon terminals of the posterior pituitary. And the function of ADH is to concentrate urine and conserve water. The diabetes insipidus is characterized by an ineffective ADH axis, resulting in inappropriately dilute urine, and will cause polyuria, which is excessive urine, and polydipsia, which is excessive thirst. Next, what is the types and diagnosis of diabetes insipidus? There are two types of diabetes insipidus. First, the central diabetes insipidus, which is due to lack of ADH secretion by posterior pituitary. Second, the nephrogenic diabetes insipidus, which is due to a failure to respond to ADH. For the diagnosis of diabetes insipidus, there are several tests. The first one is the urine test. If the urine osmolality was low, then that indicates diabetes insipidus. And the second test is the plasma test. If the plasma osmolality was high, then that indicates diabetes insipidus. The normal plasma osmolality is from 250 to 290. But in diabetes insipidus, the plasma osmolality will be from 280 to 310. The third test is the water deprivation test or dehydration test, and it has two phases. The first phase, where an individual should not drink water for a few hours, then we'll take hourly measurement of urine osmolality. If there is a low urine osmolality, then this is support a diagnosis of diabetes insipidus, and we should move on to phase 2, which is the desmopressin testing to find the specific cause behind diabetes insipidus, whether it is a central or nephrogenic. After the test is done, if the urine osmolality remains low, then it is a nephrogenic diabetes insipidus. But if the urine osmolality returns to high or normal levels, then it is a central diabetes insipidus. The fourth and last test is by the ADH level. If it's low, that indicates central diabetes insipidus. And if it's normal or elevated, then it is a nephrogenic diabetes insipidus. Now, what is the complications and prognosis of diabetes insipidus? For the complications, there will be weight loss, fatigue, headaches, kidney damage, brain damage, chronic dehydration, tachycardia, decreased temperature, and hypotension. For the prognosis for most patients with diabetes insipidus is good prognosis as long as the underlying primary cause can be treated. Also, if the individual has access to water, mortality can be avoided. Next, the treatment and preventive measures. So, how we treat diabetes insipidus? For central diabetes insipidus, desmopressin is the primary therapy and can be given by nasal spray, orally, or by injection. The second option is chloropropamide, which will increase the ADH secretion and enhances the effect of ADH. And lastly, by treating the underlying cause. For nephrogenic diabetes insipidus, it is treated by correcting the underlying cause and using a low solute diet. So, can diabetes insipidus be prevented? Most of the time, diabetes insipidus is a permanent condition, and we cannot prevent it. It's often associated with another health problems, such as an abnormal kidney function or tumors. Even though you can't prevent it, in these cases, you can still manage the symptoms. And lastly, the take-home messages. Diabetes insipidus is an endocrine condition involving the antidiuretic hormone, ADH. It's a rare disorder that affects the regulation of water balance in the body. It is characterized by polydipsia, which is excessive thirst, and polyuria, which is excessive urine. Types include central and nephrogenic diabetes insipidus. Treatment for both types of diabetes insipidus is by correcting the underlying cause. We can't prevent it, but we can manage the symptoms. Thank you for listening, and these are my references. Thank you again for your time. I really appreciate it.